patients are typically middle-aged African-American females. We have a couple men that do come, but the majority of our patients are females. Most of them are low income. They're either underinsured or uninsured.
I would say the majority of my patients are probably poverty level B or C, which means they make 50 to 75% of poverty level. So I have patients that, all joking aside, have a recognized income of $3,000 or $4,000 a year, because you're talking about people that really, they live in their own world. Some of them, a lot of them actually have jobs, but they'll be like, they're the part-time jobs that you can get that don't have any benefits, that they're what I would call working.
So I've had patients who have actually honestly told me that it's choosing between testing their blood sugar or feeding their children.
And some of them have trouble, affording their medication. Others may have complicated issues at home with family or with friends. And I guess just health tends to take the back burner oftentimes. And
patients have several different challenges. Most of them have very low health literacy, so most of them don't know how to read nutrition labels, which makes it difficult for them to make healthy food choices.
Choices may be limited. Things that impact the health of our patients include not being able to have good access to fruits and vegetables. We know that we have a number of food deserts here in Birmingham. This is something we are working to address, and we feel like we're knocking those out one community at a time.
A lot of their neighborhoods aren't safe, so it's hard for them to exercise outside, so we have to make really unique recommendations for those types of patients who don't have a safe place to go and walk.
Times that we're making choices between, do I feed my child tonight, or do I take my medication? It breaks our hearts. It is a challenge every single day that we deal with. In fact, one of my favorite stories is that one of our patients who really was quite upset when he learned that diabetes was not a curable disease. One of our pharmacists was very concerned about him. He has a history of depression as well. And over the evening, she felt very bad for this patient. She said, I didn't sleep well. I kept thinking about him. And did I do everything that I could? Where is he? What's going to happen? So the next morning, she picked up the phone. And the question was, do you have any questions about what we went over yesterday? It was, how are you? And it was that compassion and concern that turned this person's world around.
And the most exciting part of that is she was at one point actually calling us and asking, what did my A1C come back as? Now, for me to actually know that the patient remembers what an A1C is and understands that and actively is pursuing wanting to know what her level was, that to me was so exciting.
When I feel like that I've been persistent enough and I've shown the patient that I care enough, which is really the key ingredient, that all of a sudden they try it. Even if they don't believe me, they just try it and they start to feel better. Because I think if you can ever get them to feel better, you've got them. Over the last year, while I still occasionally get that patient, most of my patients now we're talking about it's time to take them off of it. Okay, now, it took 2 years to get there. And it's a team effort. Okay, and it's me, and it's the residents, and it's the pharmacy students, and it's the physician, and it's the nurses. I mean, it's all of us that have contributed to that success.